Hi there, everyone. Good evening. My name is Sarah Hunstead. I am a paediatric nurse, a mum of two, founder of CPR Kids. And what we do at CPR Kids is empower parents and families with the life-saving skills of baby and child first aid. And today we are talking about head injuries in babies and children. And I have the absolute delight of welcoming Dr. Geoff Pearce from Cub Care Health. Now, Geoff, could you introduce yourself and tell everyone a little bit about what Cub Care is?
Sure, and thanks for having me, Sarah. So yes, Dr. Geoff Pearce is my name. I'm a paediatric emergency specialist, so a kids emergency doctor. I'm trained and I work in a big public hospital emergency department on my days, evenings and some nights. Cub Care is a bit of an offshoot of that some of myself and some other experienced paediatric emergency specialists have put together to try and help parents, I guess, in the after hours period particularly. So to make some decisions and help with them in their healthcare needs for their kids in that bit of time when there's not much else open, to be honest, apart from emergency departments like where we work. So it's a way in which we hope to connect with parents and families and provide them a really high quality service in the after hours space.
Fantastic. And so how do we actually access Cub Care, Geoff? Is it fully online? What actually do we need to do to access it?
Yeah, in this brand new world of telehealth, cubcare.com.au actually is the place to find us. We've got it all set up now. Some tech gurus are a bit more smart than I am. Have worked out how we can have virtual consult rooms and have a secure and confidential chat with you about your healthcare needs for your kid and help you with that decision of, do I need to go? How can I manage my child in my own home?
Yeah, because that is one of the biggest things is, especially when we're talking about head injuries, as we will be tonight, is sometimes you have that, do I need to go to the hospital or do I not? My GP's closed. What do I do? So that absolutely helps with that. Now, everyone, what I'd love you to do is if you could give me a thumbs up or a wave that you can hear and see us well. If you are having trouble hearing or seeing us, we will be posting this to both the Cub Care and the CPR Kids Facebook pages afterwards. So you'll be able to watch that at your leisure. And please don't forget, tag any of your friends or family in the bottom who will benefit from this information, because trust me, this is something you want to know about. I have two kids of my own, two girls, and honestly, I've lost track of the number of times that they have either fallen off stuff, fallen into things, and ended up with that lovely great big egg on their head. And I know there will be people out there right now go, the egg. Yes, I know exactly what you mean by that egg on the head, because sometimes it can actually, they smack into something and they end up with this swelling and you think, oh my goodness, what do I do with this? But I think what we will be doing tonight is we will be running through the common signs and symptoms of what you need to look out for if you need to go to the hospital, and also what to expect in the hospital environment as well. But before we get into that, what I'd love to do is just spend a minute or two on prevention. Now, we cannot wrap our kids up in cotton wool. They need to get out. They need to explore the world. They need to climb trees. They need to do all of that. We just need to know how to patch them up afterwards. And so what I encourage you to do is, we can't eliminate risk, but there are times where we can help reduce risk. Number one, for babies, please, if they are in something that has a harness, use it. Whether it's on the change table, whether it's on their high chair, whether it's in the pram, please, please, please always go ahead and use those straps. They're there for a reason, because babies and toddlers are Houdinis. They absolutely are. They are amazing at climbing up on things and getting out of stuff. And, certainly I'll be telling you some stories, and I'm sure Geoff has got quite a few stories as well, of times where, I certainly remember once when my child was in the pram and I just, in my haze of sleeplessness, I forgot to clip up one of the sides of her 5-point restraint. Next thing I knew, I'm walking along, and she fell out head first onto the concrete. I don't know why I forgot. I just did. I think it was just my brain was just gone because she didn't sleep for 2 years. But it's one of those things, if it is available, you must use it. The other thing too, and I mean, we could sit here and talk about prevention for a good hour. These are just a couple of things that I'm touching on at the moment. The other thing is, please remember, make it a rule in your home. No helmet, no wheels, full stop. I've had lots of friends and family say to me, but, oh, my 18-month-old, yeah, they're great on the scooter. And, you know, they're only little. They don't go fast enough. They don't need a helmet. Yes, they do. Absolutely, they do. Make it a rule from the very beginning that if they are able to get on a scooter, if they can do any of those things on those balance bikes, that they must be wearing a helmet. It's just that simple. No helmet, no wheels. So I've just touched on a couple of things there, and I'm sure Geoff is absolutely itching to get into speaking to you about, we're going to start with mine.
I was just laughing about how much your experiences are the same as mine.
Yes, absolutely. And so one of the things that's really important is when your child does have a head injury. So, for example, your 18-month-old is riding along on their scooter in the driveway without a helmet on. They fall off from standing height, head first down into the concrete driveway. Geoff, what are we looking for? What are those signs and symptoms that we're actually looking for?
So the first thing you mentioned there is the concrete driveway. For whatever reason, they've always got the big head. They always hit the hardest thing that they can find. So it's invariably the concrete driveway or something like that. Knowing where they actually hit's really important. So is it the edge of that driveway? Is there a rock beside it? Is there something that's pointing out? Because the high speed that you described being on wheels combined with some high force over a small area is a really concerning combination. So when your child does this, they'll often have an immediate reaction. And that knowing what they do in that first initial phase is really helpful for us as doctors. So they'll do one of two things often. There'll be a really quiet and disturbing moment, often just after the really sickening thud. They'll then potentially start crying, and how long after they have that impact to when they cry is really important to sort of keep an eye out for. The nature of how they interact straight afterwards is really important too. So often kids will either hold them or will just start screaming consolably after an event like that. And knowing the timing of those things can be really helpful. I think your kids had a great article on breath holding spells, and that can often be confusing in this setting. We're really keen to know if they've lost consciousness at all. That's a really key factor to look at. So, and it can be hard to tell often because invariably we're not always hawk-like over our kids and they're scooting out the front and we're out the back or we're making something else. And so that initial time between the thud to the scream can be somewhat helpful and more worrisome sometimes when there is no scream, I guess. So a good screaming child, as much as it makes a cacophony of noise, is often a better sign from us from a head injury point of view. Once you get to them, once it's after that,
that's exactly right.
Yeah, once it's after that immediate thing, I guess it's a case of looking at what the obvious injuries are for them. They'll obviously want their mum or dad. That's a natural reaction for a kid, is to hit their head, and picking them up and consoling them and being as calm as you can in that situation is really important because they will get a read off you. So calming them down and trying as best you can to see what the extent of the damage is. So often if it's a rough driveway or things like that, you'll have cuts, lacerations, abrasions. These are all the bits that we end up with scars from our childhood in later years, and having a look at those first and staunching any obvious bleeding, I guess, is a really clear thing to do, ideally with a little bit of a wash if you can get it. But at that very first stage, it's just a matter of giving them a big cuddle and seeing what's wrong.
Exactly. And I think certainly listening to what you're saying here, and please forgive me if I am repeating anything. Full disclosure, everyone, I'm actually on holidays at the moment. I'm not in the CPR Kids office, and I've got some really sketchy internet access at the moment. So it's a little bit crackly for me listening to Geoff. So I apologise if this seems a little disjointed. So just full disclosure there. But just what I was hearing Geoff say then, it's really important that you're saying that lag between the, the thud and the cry. I love that because that is absolutely so true. And remember, it's that quiet child that worries us. They are either drawing on the walls with crayons when we can't see them, or worse, permanent marker, or they can be quite unwell. So it's always that quiet child that we want to watch. So yeah, exactly that. It is incredibly important that we are watching that. Now, Geoff, when it comes to that egg on the head, and forgive me if you were just talking about this when you dropped out with me for a little bit there, but with the egg on the head here, now, when do we need to seek medical help with that? I mean, I know that sometimes when children run into things, they can split the skin and they end up with a laceration. And I often say that parents have got the best barometer if they look at it and go, oh, it probably needs either sutures or glue. And if they look at it and go, oh, that's fine. What's with all the blood? That's tiny. It probably is okay to deal with at home. But with that egg, that's often sometimes that it can be really, really quite worrisome for parents. Is there a particular way, obviously feeling it, should it feel a particular way? Do we worry more if it's squishy? What do you think?
Yes, it's really touched on there is the fact that you've got a lot of blood supply to your head and your scalp. And so even the smallest little head wound will bleed a whole lot. So when you first see that kid who's been picked up, they'll often be bleeding and bleeding and bleeding. And only after you've managed to give it a clean and look at it, do you actually get a sense of whether it's I really need to get that cleaned at the hospital, or even, actually it doesn't look as bad as I thought it would. So knowing that they bleed a lot is a really important thing. And that's important as well with the ones that you don't break the skin. And so that's probably responsible for what I like to call the uni-horn rather than the unicorn of kids. So kids should play with unicorns. They shouldn't have these uni-horns. And you do see them quite a lot. And the best explanation I've ever had for that is that when you look at your little baby, you can often see that they've got these spidery veins that are up on the scalp in this sort of area. And if you've managed to hit your head hard, there's not a lot between the skin and the bone, apart from those small veins. If you've managed to actually tear one of those, but not break the skin outside, then they still bleed, and they bleed quite avidly. And that's why you get this big horn. Eventually, the pressure of the skin itself will push back against that, and that tends to settle back down again. So one of the things is, depending on the time after the injury, is how quick it comes up can be pretty alarming. But then if it settles right back down and it's getting a more diffuse bruise, that's slightly less alarming to us. The other question you asked there about how do you tell? It's a tricky one. It's tricky even for experienced clinicians. So we do have some rules that help us. And we talk about what's called a boggy bruise. And it's a really squishy, quite disconcerting kind of feeling bruise. And it often is associated with an underlying fracture of the bone, and that itself can be, or break in the bone, that itself can be associated with a bleed on the inside, which is what we're all really worried about. So if it's a large bruise, so if it's more than about 5 centimeters around in a less than 1-year-old child, that's a pretty significant bruise on a small head. That's a bit concerning. Or if it has that really squishy, boggy feeling, then we'd be pretty concerned about that, even if the kid looks okay.
Mm-hmm. Yep, absolutely. So thank you, Geoff. That's very, very important. I quite like the squishiness. Often we use an analogy that is like an avocado. Obviously, and one thing that we need to remember as well is that you need to trust your instinct too, as a parent. That even if these signs and symptoms that we're talking about now, even if your child doesn't have any of those, but you feel that there is something wrong, then they absolutely get them checked medically. But with this egg as well, and children don't have to have any outward signs to actually have a serious head injury as well. So that's an important thing we need to remember. But it is a common sign that we do see this egg. The analogy of the avocado, if it's squishy, ready for guacamole, then that's quite concerning and you need to see a doctor. And obviously if it's nice and firm like an avocado that you would be, okay in your salad, then obviously we still need to be looking for other signs and symptoms as well, but we can perhaps be a little bit less concerned about the actual egg itself. But in saying that, what's really important is that we are looking for the worrisome signs and symptoms. So, Geoff, what signs and symptoms would a child show, if we can just list them, that would say, I need to take my child to a doctor now or get them seen now?
So the most alarming signs for us would be if they're not responsive. That's the number one and most concerning sign. Having an altered level of consciousness is what we talk about. So not being their usual self, being very confused, dazed, not responding in their normal manner, not recognizing you or someone that they should recognize. Those sort of symptoms particularly are very concerning to us. It's rare to have it straight away, but stroke-like symptoms, so things that you would be concerned about if you saw your grandparent have it, so the drooping of the face, the not being able to walk normally, something like that would be a very alarming sign. It's pretty hard to sometimes pick up, but unequal sized pupils would be a very concerning sign for us as well. All of those tend to indicate more likely than not that there's something significant and severe happening on the inside, as well as an obvious step in the skull itself.
Mm-hmm. And what about vomiting, Geoff? When do we need to be concerned about vomiting?
Yeah, so often kids will have a vomit after a head injury. They often have a vomit after you try and give them Panadol. They often have a vomit after all sorts of things. So a single vomit in and of itself is probably not the alarming moment that you may think it is. If they've got vomiting, however, that can be a sign of pressure inside their head, and that's one of the things we do worry about. So there's various different rules we use, but anytime someone's having ongoing persistent episodes of vomiting, we'd be concerned. And I should also say the one other symptom that most parents would come for anyway would be if they had a seizure and they'd never had a seizure before. So that would very much be an alarming sign or symptom.
Yeah, absolutely. And Geoff, what about drowsiness as well when it's not their normal sleep time? Because a lot of parents say, you see in Hollywood and the movies where they say, don't let the person go to sleep, they're going to die if they do that. How does that actually fit in real life?
The number of times I've been worried about parents driving at rapid rates to emergency departments while reaching behind and shaking their child to try and keep them awake. They probably should have just called an ambulance. The drowsiness, the confusing thing about that is that drowsy after a head injury, it is a concerning sign, though. It is probably warrants someone checking them out if they are drowsy, particularly if it's not to their usual nap time or anything like that. The absolute don't let them fall asleep is probably not necessary, but they should seek medical attention, I guess, is the key. And they shouldn't let them, in the other sense, have their usual afternoon nap, but they've had a long one and they let them sleep and let them sleep and let them sleep. That would also be a concern.
Okay, excellent. Thank you. Thank you, Geoff. Now, one of the questions that we often get here at CPR Kids too is, okay, so my child has shown one of these signs, for example, we had a woman who said, oh, my child had a head injury and my child had repeated vomiting. And so I took him to the hospital, she said, and we were watched for 4 hours and then discharged. And she said that she was genuinely surprised that, number one, that her child didn't have a CT scan or a CAT scan of the head to see what was going on. And also that she wasn't sure what was going on with what the doctors and nurses were looking for in that period of time. Could you explain to everybody what actually happens when you do go to hospital with your child when they had a head injury?
Yeah, so from a hospital point of view, three different mild and the severe end. And either end, as with most things, is relatively easy. So the very severe head injured kids that have got some of those severe signs that I was talking about just before, they're obviously going to need a scan, and we'll be just going along to do that because, as you say, a CT scan is the gold standard for looking for those breaks in the bones or the bleeds on the inside that we're all worried about. The milder end of the scale is a group of patients that don't have those symptoms. They've maybe got a bump or a lump or nothing, and they're interacting with you normally and they're engaged. So what we'll go through in particular is looking at the history behind what happened, trying to get an idea of the forces involved. And then we'll have a good close look at the child themselves and see, like we were talking about before, are they interacting normally? Have they been vomiting? What's the size of the lump? Those sort of aspects of things. When you put those things together, you then develop this group of patients who are in the moderate group. And one of the biggest groups of those is the vomiting children. The challenge for us is that the CT scan that represents the best way of telling whether there's a bleed isn't without its own risks. And so we're really balancing up these two things because CTs come with some radiation and it's to a young child's head who's got a long time, hopefully, ahead of them, and they're developing at the same time. So we know that there's an increased risk in the long time of cancer if we do too many of those CT scans. So it really becomes a balancing act. So that's probably what happened to the person who you described earlier with their child. So often we substitute the need for a scan with observation instead, with the thought that if there is a significant bleed going on the inside of a child's head, they'll develop more symptoms over time. How long you observe for is a really interesting question. Most children will show signs of a severe developing bleed on the inside within 6 hours of the actual time of injury. So that's the sort of times that people often watch quite closely in a hospital environment in that moderate group. It doesn't, however, reduce your risk to completely zero. And to be fair, even on those mild kids, the risk isn't completely zero. So regardless of whether the decision has been made to scan or not, and that in conjunction with the parent and talking them through all these risks and benefits. And we've actually got some pretty good evidence where we can give you roughly the exact percentage likelihood of it being the case. Regardless of that, the parents should all be told when they go home, keep a lookout for these sort of signs and symptoms at home. And if they happen, don't just ignore them. And that probably stands true for the next couple of days. I always tell parents, don't go deep sea fishing with your kid or out bush for the next couple of days or a long way away from help, even if you haven't scanned your head, even if they're looking okay at the moment, because there is always that slight chance. And because head injuries are so common, I see lots and lots of them, and I always have to have that same discussion with every parent, really, because at some point, one of those ones will have that really slow bleed. It's hard to pick.
Yep, absolutely. Thank you, Geoff. So just a bit of a recap there. So going back to the concerning signs and symptoms. So what we're looking for, that child who's got a loss of consciousness or an altered consciousness. So meaning that they are, they're difficult to rouse. They're not their normal selves. And remember, you know your child better than anyone. If their behavior changes after a head injury, if they are not themselves, and that is a bit of a red flag as well. So we're looking at their level of consciousness. We're looking at their behavior. It's normal to have a vomit afterwards, especially if they're that kid who vomits every time they cry. That's completely normal. But persistent vomiting after a head injury is definitely concerning. If they have a seizure after a head injury, that is also concerning. Of course, if they have a seizure disorder, that's a different kettle of fish. But if your child does not normally have seizures and they do have one, that is an ambulance immediately. So that is very concerning. That is not throwing your child in the back of the car and being really worried about that. So that's important. Okay. So if they are drowsy and it is not their normal sleep time, that if they are really if you're having difficulty rousing them, and once again, as we said, that altered level of consciousness, that is concerning. Geoff also mentioned those unequal pupils, and so obviously that's not one of the things that is straight up. That can often be a little bit down the track as well. It's important to be looking out for, but I'd say you're probably more likely to see some of the other signs and symptoms first. And even if your child has a headache that is just persistent and isn't relieved by just simple analgesia such as paracetamol, that's also something that can be concerning. And as Geoff was just saying, at the hospital, if you do need to take your child to hospital after a head injury, then your child will be observed where, the doctors and nurses are looking for certain things, and they will weigh up whether a CT scan is warranted. And that's an important thing, to trust the clinicians. Ask lots and lots of questions. You want to be informed. And so that's one of the most important things. You need to understand and be informed about your child's care. And all good clinicians will sit there and speak you through exactly what they are going to do and why they're going to do it. And it's important that you ask, because that's why it's shared care. It's everybody's responsibility to make sure that your child is okay. So that's just a little bit of a summary about what we've been through. I do have another question for Geoff, and that is, when it comes to head injuries, what are the 3 pieces of information that you want parents to take away? I'm sure you've got 20, but what are your top 3?
Top 3. Number 1 would be, don't panic. So that gets back to what we were talking about at the beginning. When it first happens, don't panic. Use that time to reassure your child and get a good sense of what's happening. Don't panic and throw them in the back of the car and drive if they're unconscious. That's the good sort of hold. Second, that would be high speeds, high impacts, loss of consciousness, bad signs. Those are the ones that we're really worried about, as we've discussed. And if your child's got any of those, that's when you really should be seeking immediate care. The third one would be trust your gut. And I think you alluded to that earlier, Sarah. You know your child better than anyone else. And if they're just not behaving right, if it's been a relatively minor thing, but it's just not the usual self, then that's probably also a time when you need to seek care. But overall, I don't want to scare people too much because, as you said from the beginning, kids are hitting their heads all the time. It's probably one of the top 2 presentations at our emergency department, as with every other kid's emergency department. They need to explore the world. They need to learn that the world has full of hard edges, and most of the kids will be okay. So, but those would be the big 3 for me. Trust your gut.
Fantastic.
Don't
Thank
panic,
you.
and chat for those high impact worrying signs.
Yeah, absolutely. Thank you so much, Geoff. And it's been lovely talking to you. I sincerely apologise to you and to everybody else out there if it has been a little bit disjointed with the internet connection. Hopefully, well, I know that once I get back to Sydney, we'll have high-speed internet again. So for the next one, it will be the connection will be even better. So thank you everyone for your patience with that as well. But while we do have Geoff with us, it is not every day that you have a paediatric emergency physician on your Facebook feed. So do you have any questions in regards to head injuries that you would like to ask? So please jump on and type in your questions into the comments now if you do have any. Notice that there have been lots and lots and lots and lots of tags, people tagging people in there, which is fantastic. But usually there are lots of questions when it comes to the heads, unless, Geoff, you have done such a magnificent job that every question that everybody has wanted to ask has actually already been answered by you, which may well be what's happening, which is a wonderful thing. And the other thing that we would really like you to do as well, everyone, is please write in the comments below what you would like us to talk about next, because remember, we want to bring you subjects that are really relevant that you want to learn about. So whether it's, oh goodness, from febrile seizures to poisoning to croup, whatever, whatever childhood illnesses or injuries you would like us to talk about, we would love to do for you. So at the moment, it doesn't look like we have any questions. There are just lots of thank yous, which is great, and lots of people saying we've covered everything. Oh, good. That's absolutely brilliant. Oh, you're most welcome, everyone. I'm glad we covered everything. But just before we go, Geoff, we've got a couple more minutes. Could you please just remind everybody what Cub Care does and how we can access Cub Care?
Sure. So Cub Care is brand new. It's actually launching today. So it's a pretty exciting day for us. We're doing some of our testing at the moment, and it's basically giving parents access to paediatric emergency specialists. We're open every evening, 7 days a week, various times depending on where you are in Australia. You have to just check the website for details, but essentially after school through into the late evening. And it'll be the opportunity to get an experienced clinician who only deals in kids to have a look at your child and help you with that decision as to how and what we can manage. And we can manage quite a lot of things in paediatric medicine with a bit of experience and time. And that's, I guess, very true of head injuries like we've been talking about tonight. There's some good evidence to suggest an experienced clinician looking at your child with a head injury is as good, if not better, than a lot of the decision other people have to rely on. So check us out. We're, as I said, brand new. We're hoping that we help fill a need in the market and help a whole lot of people, help us in the public system if the busiest hours of our day are a bit less busy. And hopefully it helps parents and make good decisions with our kids' care.
Absolutely. And while you've been talking, Geoff, we've had a whole lot of questions come through. So are you happy if we stay on for a little bit longer to answer?
Yeah,
Is that all right?
Fine. Yeah, of course.
Excellent. Okay. So first of all, Catherine has said, if we have a gut feeling that the head injury isn't too serious, what can we do at home? So I certainly, from a first aid point of view, my children in particular, if they have a bump on their head, they will be the first ones to go to the fridge and get out the cool pack to pop on their bump, not directly straight onto the skin. So we use a tea towel over that. And it's not from the freezer. It's actually just cool from the fridge. But frozen peas work reasonably well as well. And so we have 10 minutes on, 20 minutes off, purely because they find that it helps them. It's like that distraction that they quite like. So that's certainly what happens in our house for a bump. But Geoff, what would you suggest from what do you do from home point of view of care?
We've got the magic Olaf ice pack too that does not just head injuries, but all sorts of things, some of which don't have any medical basis but seem to help. Yeah, so a bit of Panadol is a very reasonable thing to give as well, because even if, particularly some of the younger kids who can't describe that they're in pain, but often will be in pain. So I think if you've had a significant head knock, a dose of Panadol is not going to cause any harm and will often help a lot with the pain. Observation with the not too serious one is what you really need to do, and just see if they're behaving normally over time. The first 4 to 6 hours, as we said, are the key times, and it can be quite tricky. And I think maybe someone will ask this question, but it becomes hard in the evening time when they have that head injury just before bed, when they've been a bit crazy and climb up on top of something. And what do you do then when it is a normal bedtime and they're going to sleep all night is often a tricky question for parents. So observation's easy enough in the day, you can keep an eye on and see if they're behaving like normal. But in the night time, it becomes a bit of a trickier one. What I tend to say from a common sense perspective with parents who are usually used to having lots of sleepless nights with their kids is that one more sleepless this night is not going to be the end. And so what I tend to say is that whichever parent is latest to bed checks on their child when they're asleep, just make sure that they've got a normal pattern of breathing. Maybe gives them a nudge, doesn't make them get to deal with them back to bed again, but as long as they sort of localize and go as they would usually a heavy sleeping toddler, that's okay. If you're particularly worried that it was a really sickening sound or something a bit unusual, then the other parent can always set an alarm for sort of the middle of the night to do a similar thing. And most kids are up pretty early, so we've gone through various stages of recommending, waking every hour or 2 hours. But I think that sort of fits a middle ground where you actually have a poorer night's sleep, but particularly if that first 6 hours is going to be through nighttime, I think that's a key moment that makes it a bit harder.
Yeah, and I think you've just answered Mel's question as well. So Mel has asked, if it's a child's sleep time, do you make certain you can rouse them rather than wake them? So I think you've just answered that perfectly there with that. So I think that is answered. Mel, if it hasn't quite answered it for you, please feel free to comment again. And Cherry has asked, will paracetamol change kids' consciousness? Now, you can answer this one, Geoff. Go ahead.
No, it might make them actually happier and therefore appearing more conscious, I guess. But no, it won't impede us in any way, shape, or form assessing how conscious or otherwise they are. It's quite a safe drug as long as you stick with what's on the side of the packet in terms of dosing.
Exactly. That's exactly right. So remember, it's every time you give the medicine, not because you gave it a week ago and you remember what you gave them. Every single dose, you follow those directions on the bottle every time. Now, Catherine has asked another question as well. Will Nurofen be something to avoid in the first 24 to 48 hours?
It's an interesting question, that one. I know some places would recommend against Nurofen. Theoretical risk, I guess, of increasing bleeding times. It's not like aspirin, which is the one that is really concerning for that, and we don't use aspirin in kids, so don't go reaching for the aspirin bottle. That's a big no-no. I wouldn't be upset or concerned if your child had Nurofen, particularly if they're one of those kids that vomits Panadol every time and they're in pain. I think in the balance of things, that would be okay.
Yeah, and at the end of the day, if you are concerned about what to do, then you can always call 1300 medicine as well, or you could jump on to the guys at Cub Care if it's after hours as well. So, I'm sure they will be very, very helpful with that. Now, we do have one more question that Catherine has asked as well, is who can we call to triage our concerns about paediatric head injuries? So depending on what state you're in, you might have nurses on call, you may have Health Direct as well, who will be able to advise you and ask you questions about that. If it's after hours, Cub Care are there, so certainly that is a great place because you've got the clinician in front of you right there. So if you are concerned, and I think that's the key word here as well, is that if you are still concerned, then that is absolutely when you need to seek help. And remember, as we said before, and we say it again and again and again, as paediatric clinicians, trust your gut. Okay, really, really important. So looking as well, we've had
and that's one of the things we're hoping to do, Sarah, with. Oh, sorry. was going to say, one
No,
of the things
no,
we're looking
please.
to do too with Cub Care, that if your kid has a head injury in the early evening, and we consult on you, that we'll keep an eye on you through the evening time as well. So we'll check back in at 10 o'clock, 10:30 at night to see how they're going and so forth, because it is one of those things where we observe you need a bit of time.
Yep, fantastic. And I think that's really reassuring as well for parents, is that it's not just that one-off thing, that you guys will be checking back in over a period of time as well, which is completely appropriate for head injuries. So,
Yeah.
all right. Well, we've talked and talked this evening, Geoff. So we should wrap it up now, so everybody can go and get to their budget watching at the moment, as I'm sure everybody's probably got it on one device while they're watching us at the same time. So we were competing tonight with the budget. So anyway, thank you all for joining us. We look forward to seeing you. I'd say it will probably be in the next week or two. We will pop it on our Facebook pages so that you can actually get a reminder for the event. And what we will be talking about, I think we should be talking about rashes, because we have been asked so many times about whether or not we can talk about rashes that we need to be concerned about. So I think that should probably be our next topic. So that's what we will do. We'll have it organised. We'll have all the details on our page for you. Thank you so much for joining us. Thank you for joining us too, Geoff. And we will see you again soon, everyone. Take care. And remember, any comments down below what you want us to bring you. See you later, everyone.